Good morning. Hi, everyone. Welcome. We're so glad that you've come this morning. We appreciate your spending your Saturday morning on a Mother's Day weekend with us to learn more about mental health and our services here in Cobb County. On behalf of the Cobb and Douglas Counties Behavioral Health Work Group, I welcome you to the New Horizons Mental Health Morning. My name is Vicki Harkins, and I teach mental health nursing here at KSU. I'm a new member to the work group, and I'm so pleased to have the chance to work with some absolutely wonderful people who are very, very interested and devoted in these topics and in providing care for our citizens. Today, in these two sessions, we will cover mental health resources and cultural competency and mental health stigma. We'll hear from our wonderful four speakers, and at the end, you'll have an opportunity to ask questions. If you would like to ask questions, just stand. We'll bring the mic to you, or there's some cards at the end of some of the tables, and you're welcome to write your questions down, and our timekeeper in the back will take them, those questions, and bring them to us. Each speaker will have 10 minutes, and then we will have time for questions at the end. We will repeat this again at 10:45. If you want to hear it again, you're welcome to stay. If you have other questions that you'd like to ask after the second time we do it, we would be glad to answer those as well. As we talked about before, when we're finished, we do have a questionnaire that basically asks about access to mental health services in Cobb County. We welcome you to fill that out. There will also be a course evaluation in this room where you had some food, and we welcome you to fill that out upon the completion of the program. And then out here, we have several vendors who have come to educate us as well about the services that they provide for our clients. Our first speaker will be Foster Norman. Mr. Norman is the CEO for the Cobb County Community Services Board, and he will be speaking to us about mental health resources in Cobb County. Thanks, Foster.
Thank you. Good morning. Glad to see all of you today. Hope this will work for me. So I have a little PowerPoint, and I'm glad there's a clock on the wall so I can see my time, because this is probably more than a 10-minute presentation, but I'll try to condense it, so I'll be going through some things that maybe you might see some written statements on the slides that I may not address. First of all, how many of you in your room have heard of the Cobb County Community Services Board? If you have, raise your hand. So, wow, a good number of individuals. And you that raised your hand, how many of you think you know what we do? Only one out of that group? Okay, well that's fine. And that's pretty good, because most groups I speak to, when I ask, have you heard of us, most people have not. But then those that have, when I ask, do you know what we do, the response is about the same. I usually get maybe one or two people that do. So real quickly, the Cobb County Community Services Board, that term, Community Services Board, is a term that's in Georgia statute. So we are a part of the Georgia Community Services Board system, and there are about 24 or 25 community service boards across the state. And we are a legal entity, we are a public entity. No, we're not a state agency, we're not a county agency, we're not a 501c3 nonprofit. We are a community services board, public entity. And most of our funding is tax dollars, which either comes from the Georgia Department of Behavioral Health and Developmental Disabilities, or it comes from the county, or it comes through fee-for-service, such as Medicaid or Medicare. So these are some of the things you probably already know, but just to go through a couple of these on this slide, we know that in any given year there's about 44 million Americans that experience a mental illness. We also know that there's about 10 million of those that are experiencing a serious mental illness. We also know that suicide is the 10th leading cause of death, second leading cause of death, those ages 10 to 34. And something, yesterday I went to the Cobb County Veterans Court graduation, if you know about the Veterans Court in Cobb County. But there are about 20 veterans that die every day by suicide. And serious mental illness costs our country about $193 billion in lost earnings each year. Sorry, too many buttons. So our agency has an annual operating budget of about $25 million. We have about 320 staff. We have a number of locations across the county. And our purpose really is to provide the safety net to individuals who have a mental illness or who have an addictive disease or who have an intellectual and or other developmental disability. And when I say safety net, what I mean by that is that we are that agency that if individuals do not have the means to pay for those services, in other words, they are uninsured and they don't have a job where they make a lot of money, where they can go and shell out $100 to a therapist or a couple hundred to a psychiatrist, and or they may be underinsured because we know that there are a number of individuals who may have signed up for a health plan through the Affordable Care Act and whose income is low, thus the federal government pays their subsidy of their premium each month, but someone forgot to tell them that when they go to the doctor that they have to pay a copay. And so then they walk in the door and they say, yeah, I've got insurance. But then when they're told, okay, well, you got a $25 or $30 or $40 or $50 copay, they say, well, I really can't afford that. So that's an example of an underinsured individual. And in some cases, you might as well even say that they don't have insurance at all if they can't afford the copay. So we are that safety net provider. So I usually ask if someone has a physical health issue and doesn't have insurance and doesn't have the means to pay for it, where do they go?
Emergency room.
Emergency room. When someone has a mental illness and needs to seek care and don't have insurance and can't afford to pay for it, where do they go?
They don't know.
They don't know, and there's another answer, the same one you gave, emergency room. So I'm here partly, I think, to tell you that Cobb County Community Services Board is that resource in this county for those individuals. Whether it's a routine issue or whether it is an urgent issue or whether the individual is in crisis. So we provide an array of services including outpatient, some intensive outpatient, day programs, residential programs, and crisis programs. And our Behavioral Health Crisis Center, you may or may not have heard of it. It's located really 2 buildings down from our outpatient clinic on County Services Parkway. And this crisis center is open 24 hours a day, 7 days a week. People can walk in. Family members can bring folks. You don't have to have an appointment. Law enforcement bring folks to us. As well as, you might think this is odd, but in our outpatient clinic, if someone is new to us, in fact, we don't even make appointments. Now, why do you think that may be?
They aren't willing to tell anybody.
And for individuals who have a mental illness or a substance use issue, if they've gotten to the point where they have realized, I need to seek help, well, you need to give them that help right now, because if you wait, then they've changed their mind again. And back to, well, there's no one out there really that can help me, or there's no one that will help me. So we want to say to folks, we will help you. And what we say to a new time caller is walk in. Here's where we are. Just walk in. Can you come this afternoon? No, but I got transportation. I can come in the morning. Fine, come on in. So when the folks walk in, then we do that assessment, initial assessment, to determine what services that they need. And if someone needs some ongoing therapy, then that first appointment will be provided to them within 3 to 5 days. If the individual needs to see a psychiatrist for medication evaluation, then our attempt is to get folks seen in that first appointment within 7 days of that initial assessment. And I think we're doing pretty good right now with the 3 to 5 days for the therapy. 1 minute, sorry. That's how you get into our services. Let's see if there's anything else that I want to say real quick. Yeah, let me go to the last page. So Georgia has a crisis line. This is statewide. It's the Georgia Access and Crisis Line. It is an 800 number. You can call that crisis line. We also have local numbers. The top number is we have an access center. And then the crisis center has their own number. And if anyone ever, you run into someone who says, that group didn't help me at all, you can call me. And we'll figure out why. And then we'll figure out how to get help. So I guess my time's up.
Thank you. Thank you so much. If you have questions, again, write them down. You can give them to us and we'll look at them at the very end. Our question segment will not be taped. Only the speaker's time is videotaped. So our next speaker is Wendell Fields. We're so excited to have Wendell. He's a suicide and depression survivor. He has over 25 years of coordinating care and services for individuals who manage chronic and severe mental health symptoms, substance use issues, and he works he works through the Georgia Department of Behavioral Health and Developmental Disabilities Commission for the Region 3 counties, doing a mobile crisis response on that team. So he's working through Region 3, and we're so excited to have you, and thank you for being here.
Thank you all. Well, good morning, everybody. How are y'all doing? How many people are doing great, spectacular, just yippee-ki-yay today? Can I get a hands? Can I get a hands? Oh, okay, good crowd, good crowd. How many people in there? Okay, I'm all right. Okay, yeah, this is it. How many people not doing too good today? Just not feeling it. How many people don't know how they doing right now? How many people just don't give a rat's patootie right now? Feelings. Nothing more than feelings. Nothing more than... What happened if we didn't just acknowledge that? I want you to close your eyes for a moment. Close your eyes, close your eyes. I'm not going to bother you, I promise you. I want you to think about that it's about 3 o'clock in the morning and you fast asleep. And it ends up that you're hearing the bang, bang, boom, boom. You hear voices in the background and you decide to wake up and you find that one of your loved ones is hallucinating. They're delusional at the time. The bang, bang is them trying to bust the pipe open because they can hear little men in the pipes. And they want to get them out to free them. And you're like, oh my goodness, what can I do? They're not hurting anybody, and they're not hurting themselves. But boy, they are hitting that doggone pipe real hard. What do you do? Open up your eyes. What do you do? Who do you call?
I don't know.
Thank you. That's where mobile crisis comes in, as well as behavioral health link, GCAL. Anybody heard of GCAL? Georgia Crisis and Access Line. That's who we are. And in that, we have 2 services that we provide. One, you call in the call center. And you say, hey, this is going on. I don't know what to do. And they're going to ask you a series of questions. And then they're going to ask, okay, how do you want us to help you today? They're going to give you some options. They're going to say, hey, if that person can calm down, we can set them up with an urgent appointment tomorrow. Or they will say, well, put them on the phone. Let's talk to them. Let's see what's going on from their point of view. Or if it's just really bad, we send out mobile crisis to you. Okay? So, here it is. You call the call center and they say, hey, this is going on. They try to get the person on the phone. They're not able to. And so then it ends up that the third party person, you say, look, I really need some help here. Can you bring somebody out? And they say, of course, we got the mobile crisis team. And they come out and they do on-the-spot assessments. On-the-spot assessment. You have a clinical licensed individual, sometimes two, sometimes one. But believe me, you are going to get a professional to come out and do that assessment with that individual. I myself, as a field care consultant, comes out and I make sure the area is safe. I coordinate services. I call numbers to try to help out with the situation at hand. Okay? And so it becomes interesting because that 3 o'clock that I was talking about was my mom. And she was thinking that people were in the pipes. And she had to free the people in the pipes. And the team came out and they were able to sit down and see what was going on with my mom. Sometimes it's that the chemicals in the brain is not doing so good. Either the brain isn't producing a lot or it's producing too little of the chemical. So it brings on hallucinations. It can bring on. But sometimes it's dementia. And there's two different things with that that's going on. So in that, the clinician came out. They talked with my mom. It ended up that my mom really wasn't doing well. And it ended up that she had to go to the hospital. And so in that, she didn't want to go. So we helped coordinate services with that. So how many people have ever heard of a 1013? Raise your hand. What is a 1013, ladies and gentlemen? Can I get a volunteer? Oh, come on, don't be shy now. What's a 1013? Say again? Yes. It means that you're going into the hospital involuntary, at least for 3 days. So they can evaluate you to see how we can help, to see if the medications can work. They do a whole plethora of assessments there. But we help coordinate those services, okay? So you're never alone. We are 24/7. And we're 365 days. And guess what? We're free. Free. People are available to you at any moment, at any time. So when I come out, I coordinate the services for you. I call. I do all of that. But guess what? I'm the person that follows up with you too. So I'm going to call you the next day, the day after, or the day after that and say, hey, how are you doing today? What's going on? Hey, how did we do when we came out? Were we courteous and professional to you? Did we let you know what your rights and responsibilities were? Do you feel that we respected your race, your culture, your religion? Hey, did we give you a safety plan, a plan that helps you to get through if this happens again? As well as, was we helpful? Was the service we provided, was it appropriate? These are the things that we provide. And we're happy to do them. And guess what? The other people are happy too. Because the results that I get when I call, it's amazing. People say they were so friendly, they were kind, they were loving. They didn't make me feel like I was nothing. You know, with mental illness there comes that labeling. People don't want to be labeled. They just want to be a human being. So that's the reason I started off with, hey, how many people are doing great, spectacular, just yippee-ki-yay? Because all of you are human beings, whether you have a mental health issue or not. whether you have a substance abuse issue or not, whether you have a developmental disability or not. You're a human being, and we're here to serve you. So, in the closing, just know that you all can look this up for yourself. If you don't believe me, you can go to BHLTEST.com and look it up for yourself. And our number, as the gentleman has already expressed, is 1-800-715-4225. And they will connect with you, and they will help you. And don't forget those questions I asked. Hey, how you doing today? Because it's the most important one. Because if somebody would have asked me, I think I would have had shared that with them. I wouldn't have tried to take my life. So y'all keep on keeping on. Keep smiling. Keep helping the people who you help. Because each and every one of you got a gift and ability to help someone for that day. Okay?
Thank you so much. In accordance with what Wendell's discussing, we are also offering depression and anxiety screenings today on the 3rd floor in English and in Spanish, if anyone would like to. We're now going to move into our cultural competence and mental health stigma section. Our next speaker will be Belisa Urbina. Ms. Urbina studied business administration at the University of Puerto Rico. In 2001, she co-founded Ser Familia Incorporated, which is the leading program in Georgia providing coordinated multidisciplinary family, social, and mental health services for Latinos. She is a member of Cobb County's 2020 Steering Committee and past chairperson of Kennesaw Hospital's Regional Board of Directors. She's received many important awards for her work on behalf of the Latino community in Georgia. She's been married to her husband Miguel for 34 years and is the mother of 5 children and the grandmother of 5 as well. Welcome. We look forward to hearing what you have to say.
Good morning, everyone.
Good morning.
Ser Familia started as a program to help those couples that were struggling in their relationship because there was nothing out there for them in Spanish. And it eventually evolved as we identify other services that were needed on the community. Parenting classes, programs for families, and eventually evolved into providing mental health services as well, because that's one of the most difficult services that there is out there for Latinos. It's very difficult. I'll speak about stats in a second, but it's very difficult for a Latino to find services that are culturally proficient and that are provided in Spanish. We have 4 locations, 2 in Cobb County, Acworth and Smyrna, and then we have 2 locations in Gwinnett County, Norcross and Beaufort. Back there, that beautiful lady there is Marlena Dames. She's one of our counselors out of the Beaufort office. So why is it important to take care of our Latinos? Why are they important on our community? Because that population is growing. That population is here to stay. According to the projections of the U.S. population, the white non-Hispanics are going to become a minority on the country by 2050. The black non-Hispanic population is going to stay about 12% of the population. The Asian community is going to keep on growing, but they are going to be by then about 8% of the population. But the Hispanic population in the nation is going to be 30% of the population. Here in Georgia, the Atlanta Regional Commission is telling us that by 2040, the Hispanic population is going to grow by another 153%. There would be some counties that will have a majority of Hispanic population. In Cobb County, in 2040, 1 in 4 residents is going to be Latino. And that population is mainly growing from second-generation kids. 85% of our Latino teenagers right now are citizens or residents, so they're here to stay. They are part of our fiber. But many times we think about people from other cultures, and we think that they have to become assimilated into the American culture. And the idea is not to assimilate, it's to acculturate. And that's a very different idea. Acculturate means that I don't need to stop being who I am in order to be an effective citizen of this state and this country. I am Puerto Rican, I am Latina, and I am very proud of it. I love my funky Latino accent, and I wear it with pride. But at the same time, I have lived in Paulding County, Georgia for 20 years. That's home for me. I foresee myself living in Paulding County, Georgia for the rest of my days. So I just want to make Paulding County, Georgia, and Georgia in general, the best place, because my 5 grandchildren are Georgia natives. So that's an important thing that many times we stop paying attention to. America is not a melting pot. America is a salad bowl, because we don't need to be the same. When we retain the characteristics of who we are, but we learn how to be together in that salad bowl, then we're going to make a society that has a stronger fiber and who has citizens that are stronger, better, and that have more opportunities to shine. So many times when a family moves to the U.S., there is a period of decompensation. There's a problem in which the kids start, acculturating better. Parents, many times it's different for them. They have lost their support system back at home. They don't find a support system here. So you're going to see a struggle within that family. And many times that struggle can degenerate in family dysfunctioning and mental health issues. We see a lot of that right now with our young Latinos. Right now, we see statistics, with young Latinos that are very concerning. 43% of our Latino youth in Georgia say that they feel sad, hopeless, and that those feelings are hindering their normal activities. That statistic nationwide is 32% for Latinos. It's 43 in Georgia. For the rest of the population, it's 27 for whites and 28 for black students. 1 in 5 Latina girls is going to make a suicide attempt. That number is scary because many times people are not going to know that it is happening because they're going to be using what we would call ineffective means, pills, some other things that are not going to allow her, luckily, to complete the attempt, but then nobody knows what's going on until many times it's too late. 23% of our Latino teens in Georgia have a suicide plan. So we have to take care of these children in a manner that speaks to their culture and their language. And I hear day in and day out people say, why do you still provide services in Spanish? Many of the young people that come to you speak English. But many times we fail to acknowledge that feelings happen in a language, that emotions happen in a language. We have had in our organization a teens program it's about to be 16 years now. And through the years, I have noticed that these Latino teenagers, they speak English, but when things get tough, when emotions become rough, when they are really sad, when they are desperate, it's Spanish that what comes out. And it is not only Spanish, it is Spanish with an accent of a country that they have never visited. Yesterday, actually, I was speaking to one of our counselors, and he was saying that he has this client, and this girl was born and raised in Georgia, and he was like, whenever she gets emotional, she has this very heavy Venezuelan accent. It is so interesting, and each of our providers will tell you the same story. So we need to keep paying attention to those cultural characteristics. That is important. Also, for those of us that are older, who were born and raised in another country, our relationship happens in languages. My relationship with my husband happens in Spanish. We are both bilingual, and we might be talking to a salesperson in a store. But when we are ready to make our decision, that decision is going to be made in Spanish because it's about our relationship, not the relationship that we have with the salesperson. So it is important that we keep providing those services, but the main problem that we have now with those scary numbers, we don't have enough providers. To give you an idea, the Metro Atlanta area is home to close to 700,000 Latinos. We have, give or take, 70 licensed therapists and counselors. We have 5 psychologists that can speak Spanish. Ser Familia is this big, we have one of them, Dr. Carla Santiago. We have, depending on if the providers are doing the service or not, we have 5, 6 psychiatrists that can speak Spanish. So we have a very low number of providers, and sometimes we don't see the will on the entities that have the power to make those decisions on finding new providers, hiring new providers, empowering students that are coming out of the university so they get trained to serve Latinos if they are bilingual. So, it will take a will from all of us to make changes that will change the outcomes of these Latino young people so they become what they are supposed to become, and they can really take out all of those good things that they have inside and become great members of our society. And then we won't have a crisis in the future, which is looming up on us. If we fail and we neglect, these mental health statistics that we are seeing in our young Latinos. Thank you.
Thank you so much, Luisa. There's so many things for us to think about and plan for our future. Our last speaker this morning will be Jeff Earl. Jeff has been a counselor and addiction recovery specialist for the Center for Young Adult Addiction and Recovery here at KSU since June of 2016. Jeff provides counseling for students in the campus recovery program with the goal of helping them gain and sustain long-term recovery. He's been working in the field of addiction and mental health counseling for over 9 years at various treatment centers throughout Metro Atlanta. Thank you, Jeff. Glad to hear from you.
Well, I'm going to talk to you about something that is a major problem, and that's this negative mental health stigma issue. I was going to introduce myself, but she just did a wonderful job, so what's the point? Here's the problem. More than 40% of people with serious mental illness do not seek treatment. Approximately 1/5 of patients quit treatment prematurely, with 70% of all dropouts occurring after the first or second visits. More than 40% of persons receiving antipsychotic medication fail to fully comply with the prescribed regimens, and that failure increased rehospitalization threefold at a cost of $800 million worldwide. That's a big problem. That's a big problem. And there are multiple factors as to why this is, but one of the largest, and it's a little hard to pinpoint that down just based on the sheer what it is, but one of the big reasons is this stigma regarding mental health. So let's just take a look at it. Let's take a look at some definitions to get on the same page. Stigma, mark of disgrace associated with a particular circumstances, quality, or person. That's the nebulous word stigma. In general, it just effectively means that if you have this, you are marked with a big X, and you are less than, you're inferior, you're incompetent, and then when you add mental health into that, you become dangerous and violent and all of those wonderful terms that nobody wants to be labeled with, which creates the problem. 2 primary types of this are public stigma and self-stigma. With public stigma, that's the general society and their views of mental health. And it's the perception that someone suffering with a mental health illness, that they are socially undesirable because of the factors we just talked about. They're incompetent, they're less than, they're not one of us. They're dangerous, which makes a fear element come into it. And how this plays out is 58% of people who do not want someone with a mental health illness in their workplace. Do you think that could affect hiring? You can go like this, or obviously that's going to affect hiring. 68% of Americans do not want to have a person with a mental illness marry into their family. So you can see the problem, and this is the overall view with many people in our society, or society in general. Here's where the real problem comes in, is when we start as individuals to take all of that in. You understand what I mean? when we start to conform our views, and this no longer is a public stigma, but it becomes a self-stigma. So you are someone who has internalized all those prejudices. So now, instead of the society feeling that they're inadequate, it becomes, if I have this, I am inadequate. If I have some sort of mental illness, I'm less than, I'm incompetent. I might even be dangerous, and the doubts start flooding into your head. Are you with me?
Yeah.
Okay,
Yes.
because I'm getting some looks like, I don't get it. So just be sure. So it causes people to have these negative thoughts about themselves. I can't recover. I don't deserve treatment. It's a hopeless cause anyway, so what's the point? You know, I am what I am, and there's a big L on my forehead, effectively. Because I believed what the public has fed me probably since the day I was born. You know, this is a long-lasting stigma that's been here for quite some time. How this plays out, 57% of those surveyed believe that people are caring and sympathetic to persons with mental health, but only 25% of adults who actually experience mental health believe this. So there's kind of a disconnect too, because if you ask the general public, do you think that people should, you know, with mental disorders or mental illness should get treatment? They all say, yeah. The people who actually suffer them are saying, yeah, but, and there's the big but at the end of it to say, I'm not gonna let you put that big label on me. So they hold back. They're not really believing that the general public is all that caring because of life experience. Effects on the family. Stigma not only harms many people with mental illness, it injures the family, obviously. Between 1.25% of family members believe their relationship with a person with mental illness should be kept hidden or otherwise a source of shame to the family. Or otherwise it'll be a source of shame to the family. Wow. So effectively we've got a situation now where this stigma is creating an atmosphere of hiding. I don't want the label, therefore I don't say anything. And the families all get together and they're like, yeah, I know we have this problem, or literally this one person has this problem, but we'll deal with it. We'll keep it inside the family. We're not going to bring it out into the open because then all of us have the red mark. Family shame is 40 times more prevalent in families with people with mental illness compared to families who have members with cancer. So when you compare this to physical ailments, obviously the shame is 40 times higher. It's 40 times more prevalent, this shame, which is a big driver for why we want to keep this under the covers. We don't want to have the shame, but also we don't want to have the blame. Because one of the other stats says that the public frequently blames parents for the symptoms and disabilities of a child with mental illness. And what's interesting about that was it used to be a thing where it was bad parenting. Well, the reason why they're the way they are is because you're just a horrible mother or a horrible father. Then when science kind of said, well, wait a minute, there's a whole lot of other factors involved. Like you were talking about the serotonin releases and all those sort of things in the brain. Okay, well, that's a physical factor. So it's not really a parenting factor. Yeah, but now it's your fault because your genetics were bad and you threw that on your kid. So it's still you. You see what I mean?
Yeah.
So bad parenting or bad genes. But either way, it's your fault. Well, no parent wants to take that on, obviously. Children with people who have mental illnesses may be viewed as contaminated by their parents. This is, if you get into a lot of your elementary schools and your high schools, the last thing that these kids want to talk about is, you know, dad's severely depressed. My mom's a schizophrenic. They don't want to talk about that. They want to talk about everything's great, perfect, wonderful, because of this label. Something's wrong with you because of your parents. The results, family members who are shamed by a relative with mental illness may want to hide it. A group of 178 family members showed that about 25% worried, or this is an interview with 178 family members, 25% worried that other people might blame him or her for the relative's mental illness. Okay, let's get into this. Some solutions. All of these are wonderful things. They're all wonderful things. And what they're designed to do is stop discrimination. These are all government-instituted programs designed to stop discrimination in employment, housing, healthcare, education, all the way across the board. The problem with them is, and they do that to an extent. The problem is that the public and the self-stigma still remain. None of these things change this in me. They can make it so that I can get a job, and my boss is sort of forced to hire me, sort of, kind of, or can't at least fire me. But in his head, he's still thinking, oh. See what I mean? So the real solution is this, and that's exactly what you are doing here today. Becoming educated on what the problems actually are and what they really are. And that no one is really to blame. The parent nor the child is to blame for mental illness either way. It's something that happens, and it's something that needs to be dealt with. It's not something that should bring on shame. It's not something that should paint a red letter on our chests. You're following me, right? So this is exactly the area that we need to be in, this education. And then with this public education, that's not where it stops either. Because the vast majority, as you can tell, the city of Atlanta, and we're having this, and this is the show up. So the vast majority of people aren't going to be here. Which leaves the responsibility to you to share just what you learned today. To share with all those around you, hey, this stigma's gone on long enough. People are avoiding treatment. This problem is growing because people are afraid that they're going to be labeled. Church people are trying to maintain an image, and this gets into the way of the image. You understand what I'm saying by that. But just in general society, we're trying to blend in. We want to be accepted, and we're finding we can't because we have this issue that's really needing treatment rather than stigmatization. We're not going to do that. There, you can look all those up and get all my notes. Was that helpful?
Yes.
Yes.
Thank you.